Bodies are being left in the streets in an overwhelmed Ecuadorian city. The streets of Ecuador's western city of Guayaquil are deserted, with few residents in sight and a few dead, as bodies are being left in the streets of this overwhelmed place. The coronavirus pandemic is overloading the public services in the country's most populous city to a point of collapse. Hospitals have no beds left to accept sick patients, and morgues, cemeteries, and funeral homes are straining. With no place left to put them, some residents say they have no choice but placing them outside. It's unclear how many of the deceased are dying because of COVID-19. Many families say their loved ones had symptoms of the virus, while others only know the ill were unable to be treated at Guayaquil's overwhelmed hospitals. "We have been waiting for 5 days, Fernando España said in a video obtained by Reuters on March 30, as he complained about the struggles to have authorities come pick up his family member. As the pandemic spreads into Latin America, Guayaquil has emerged as a major flashpoint, with more cases in the surrounding province than in most countries in the region. Authorities have officially reported more than 1,300 confirmed infections and 60 deaths in and around the city, according to a Johns Hopkins University tally, though a nationwide lag in testing means the death toll is likely far higher. Up to 150 corpses are picked up daily, Jorge Watt, the leader of a government task force, told El Universo newspaper. With the municipal morgue full, an even greater number of bodies may be waiting on sidewalks and inside homes. Diego Diaz Shamba told the Miami Herald it took him 5 days to bury his 79-year-old mother, Elsa Maria. After suffering a series of small strokes, she was refused admission into all hospitals. Her sons tried to buy oxygen tanks to keep her alive, but the cost became unbearable, Shamba said, and their mother eventually died of cardiac arrest. "Every day it's getting worse," Diaz said. "We see them burning bodies on the street. Nobody is picking them up at the houses. The only option is to leave their loved ones on the street or at the hospital if they died there. We are tired of calling 911 and the only thing they tell us is to wait. They are working to solve this," he continues as he moves the camera through a window to show a black plastic-wrapped shape inside the home, with 2 fans blowing on it. "The smell is too much to take. It's the odor from the body that one can no longer handle," España's neighbor, Glendaleria Vera says in the same video, from across the street and behind a mask. "And we also have neighbors that are elderly. I have my mother who is 80 who is also having respiratory problems. To prevent coronavirus. 1. Wash your hands frequently. 2. Maintain social distancing. 3. Avoid touching eyes, nose, and mouth. 4. Practice respiratory hygiene. 5. If you have fever, cough, and difficulty breathing, seek medical care early. Stay informed and follow advice given by your healthcare provider. Also ensure you follow government guidelines.